healthcare can be costly in many instances, but here in Da Nang, I have not received any type of healthcare besides getting my teeth cleaned. So today we are going to go and see the cost of healthcare. Ciao. Hello.
With milk?
Yep. Come on. Okay, so we're on our way to Vinmac because we have an upcoming trip to Ghana. But for many of you guys, you probably already know that going to Ghana requires getting anti-malaria medication. So we had to chit-chat about it a few times back and forth with the hospital, but they have the medicine, and so we're headed up here to get a consult and then of course to get the anti-malaria medication. I would say if you guys are here in Da Nang or you plan on coming here to Da Nang, Vietnam, maybe the first person that you speak with won't understand what you're talking about, even if you know they do speak English. Because the first person that I spoke with, I gave her the same drug name as I gave the second person, and she's like, oh no, we don't have. And then I gave her like a different name of the medication because there's multiple names for the specific medication that I'm looking for, and she said, oh no, pharmacy said we don't have. And I'm like, okay. And she was supposed to transfer me to the pharmacy so that I can ask them, because there's like a few different drug names for it, and so I never got fully transferred all the way to it. And so the second person that I spoke with, I hung up and called right back. And so the second person that I spoke with, he was kind of sort of trying to do the same thing. Oh no, we don't have. And I'm just like, doxycycline. All hospitals have doxycycline. And he said, let me look up doxycycline. He looked up the same name that I gave the other lady. And guess what? He was like, oh yeah, we have. Same hospital, same system, but one person said no, they don't have. Okay, so when you guys are coming, or if you guys are here, just always, you know, fight a little bit harder, you know, if they say that they don't have something, you know, especially if there's a different name for them, ask them to look again. Ask them to look again. Even when I called the other hospital, they're like, oh no, we don't have anti-malaria medication. But you know, some people don't, I don't know, maybe their system is not as vast as the healthcare you know, hospital system. Like, I'm a scientist, and so when I was at work, you know, if I was curious about, you know, a drug or procedure or anything like that, all I had to do was like log into my portal for that healthcare for the hospital and type the name in. Okay, yeah, we do this procedure, or no, we don't do the procedure. This facility, our partner facility, does it. Or if it's a prescription, no, we don't have it. You know, this place has it. So I guess not all systems are clearly created the same, and of course all people are not created the same. But long story short, we made an appointment. We're on our way there. Hopefully we're not late, because I have my appointment and then Isabella's gonna have her appointment. So I have an appointment with a GP, general practitioner, and the cost, just the consult cost, is 690,000 Vietnamese dong. Let me translate what that is, because I'm gonna translate it now. 690,000 Vietnamese dong. All right, so 690,000 Vietnamese dong is about $26.24 to have a consult with the doctor. And you guys, while I'm there, yes, I need the anti-malaria medication. Both of us do too. Isabella has to see the pediatrician for the same exact thing. But while I'm there, I might as well get my blood work done. So I plan on getting my blood work done. Last time I got it done, it was months ago. Actually, maybe about almost 6 months ago, over in Bangkok, when I did my full healthcare checkup. So I'm just gonna get my normal labs done here and see what the cost is, and I'm taking you guys on for the ride, so come along. All right. Come on. So we are here. There's a bakery over here. Oh, it looks pretty clean. They said number 2. They said to go up to number 2. They said number 2. Morning. I have an appointment. They said number 2. It says love.
Taking your breakfast time.
Yes. I should have brought my own can. Thank
May I
you.
have the patient passport?
Yes. So we just got through checking in. Downstairs, the check-in was pretty seamless. They just needed our passports. We're already in the system. Now we're getting ready to go see the doctor. Where's it here? Oh, it's pediatric. It's at 10:30.
Okay.
Come on. It's for pediatric.
Oh, okay. So now you go to room 084.
Okay, come on. So I got my room number. How are you? This is
Move your feet. Yeah.
Yes. Okay, thank you.
push is 129 over 68. So let's go over some of their packages. So this is the standard package. It is 5.8 million Vietnamese dong, and it includes all of these items. So hopefully, actually, hold on, let's make sure you can see it. Okay, it includes all of these items. And then there's some more on the next page. Complete blood count, antibody, autoimmune tests, rapid fecal occult, urinalysis, chest x-ray, abdominal ultrasound of liver, gallbladder, pancreas, spleen, kidney, bladder, transabdominal ultrasound of uterus and ovaries, ultrasound of urinary system, okay, ultrasound of bilateral mammary glands, a mammogram, thyroid ultrasound, normal ECG. All right. And then they have another package. Before I read that package. So this is everything that's included in the standard. I'm going to actually read it off. All right, so we got ENT examination with endoscopy, general internal medicine examination, blood pressure, weight assessment by nurse, visual test by nurse, ophthalmologist exam, dental exam, dermatology exam, surgical examination, gynecology examination, HPV testing, AST, ALT, GGT testing, cholesterol testing, triglycerides, HDL, LDL, creatinine, urea, uric acid, glucose, hemoglobin A1C, free T4, and TSH. All right, so that's the standard package. It's gonna be even more fancier. Hopefully you guys can see it, but if not, advanced package is $9 million. It includes ENT examination, endoscopy, basically everything that we got in the last one. Oh, actually, no, this is a little bit more. ENT, general internal medicine, blood pressure, weight, visual test, ophthalmologist, color fundus, photography testing, dermatology examination, surgical examination, dental exam, gynecology and breast examination, liquid prep, cytology test, HPV test, fecal occult blood test, as measurement of AST, ALT, cholesterol, triglycerides, HDL, LDL, creatinine, urea, uric acid, glucose, hemoglobin A1C, complete blood count, antibodies, hepatitis B tests, 2 different tests, Epstein-Barr virus, which is mono, and some cancers, hepatitis B, a different test, hepatitis C screening, free T4, TSH tests, and prostate test, PSA for guys, and then another PSA test, quantification of AFP, urinalysis test, ECG, thyroid ultrasound of mammary glands. You get a mammogram, you get an abdominal ultrasound, liver, gallbladder, pancreas, spleen, bladder, and then transabdominal ultrasound, uterus and ovaries, and then ultrasound of the urinary system, kidneys, adrenal glands, bladder, prostate for men. All right, and then select one of the following services: chest CT scan without contrast, a chest x-ray, or a low-dose CT scan of lungs for tumor screening, and that's the $9 million VND. So I have to pay. Hello, I'm here at the cashier desk. So my total for my exam and all of my labs is $2,252,000 Vietnamese dong. So right now we're at the cashier. You have tap? You have card?
Yeah.
Okay. Do I pay for the doxycycline here too?
For the test and the consultation fee,
When do I pay for the pharmacy?
later, after you have the result, the doctor give you prescription, so you go downstairs to buy the medicine and buy there. Here, doctor.
Come on. Thank you. All right. So this is my total $2,252,000. Wait, $2,252,000. And the appointment, as I said earlier, it was $690,000, so about $26. And then I have a whole bunch of laboratory tests that I have chosen to get, which is $1,562,000 Vietnamese dong. Let me see how much that is. $1,562. So the laboratory test is $59.41. Mm-hmm. 86. Come on.
Sit here.
Come on. So for my blood test, it was $59.41, and the doctor's visit was $26 and some change, which is not that bad. So I always get my blood count. I got low iron, and I always get my cholesterol and stuff checked. But everything is looking good. And the doxycycline for 70 tablets, it was $100,000 and some change, so roughly about $5, which is good. Does you want to hold this? Yes. That one too? The green?
Yeah.
Come on. And then just this?
You are anything right?
Okay. Come on. You want to come sit with me to the bathroom? Okay.
Put it here.
Come on. Is that it?
You come back for reception.
Come on.
What's that?
You want to sit back?
Huh?
It's crackers. Huh? You're not hungry? I want vegetables and meat. I don't know. We'll make it right there.
Okay, so now you wait for your result.
How long?
I think maybe 1.5 hours. But
Okay. So now we're off to Isabella's appointment. Hello.
Vaccine.
Hmm?
Vaccine. I want to vaccine. $50.
115?
Yeah, 150.
50?
Yeah.
Kilograms?
No.
150 pounds?
No. Centimeters.
Oh, okay. 150 centimeters. Here, we're going to Ghana, and we need anti-malaria. No, you can. Doxycycline. Okay. Yeah.
You want to buy this medicine?
Yes, 70 tablets. We're gonna be there for 1 month.
What type of disease?
It's to prevent malaria.
Malaria.
You see, prevent malaria. We're going to Ghana.
The medicine is normal. More simple, more thuốc thôi.
Go get a sticker. So now we have to pay for Isabella's. Give it here. I'm just taking just the paper. All right. So Isabella's is the same as mine, 690,000 Vietnamese dong. So roughly $26 for her appointment with the doctor. And her prescription is 100,000.
What's your name, please?
She's trying to figure out how you got your hair like that.
Ca răng đó là cái kia là khách hàng làm chưa? Tại vì họ mất của họ bên bảo hiểm giáo thì chịu khó.
Thank you. We got the prescription. We give that to them, and they give us the prescription. Sorry.
Prescription here.
Okay.
Downstairs.
And the pharmacy downstairs?
Yeah.
Ah, come on. Thank you. Mm-hmm. Oh, this? Now I have to go get my results and my prescription.
Thank you.
Hello. Did my doctor bring my prescription? Did my doctor bring my prescription yet? Ah, thank you. This for both of them for pharmacy or just one?
Always the same one.
Off to the pharmacy we go to pick up our anti-malaria medication. Come on.
Two of it.
Yes.
The same.
Yes, same.
Antibiotic. To take one capsule at a time.
Mhm.
In the morning afternoon.
Okay.
This can have side effect on stomach.
Mm-hmm. Take it with food.
That after and you drink plenty of food.
Okay.
And don't lay down for at least 30 minutes.
Okay.
If you have probiotics, you can do it because it can kill the good bacteria.
Okay.
Take probiotics after these 2 hours. If you have probiotics, you take
Do
probiotics.
you recommend probiotics? Do you have them here?
We have
How much is the medicine? Is it 100,000?
yeah.
Yes, 115,395.
You will pay by card.
I'm gonna have tap. You have
Okay.
OPay?
For 2 bill is
Yep.
Two.
230, 790. Come on. So we got our anti-malaria medicine. All right. So it's a 70-day supply, and it was $8.74 total for included. This includes Isabella and my prescription together. So it was about $4 and some change per person for a 70-day prescription of doxycycline. So my ending experience about coming here to the hospital and getting healthcare services here at Vincom Hospital, you guys, I had a really good visit. I walked right in, I had an appointment, was able to go right up, see the doctor. showed them this what the CDC website had recommended. They wrote us our preventative malaria vaccinations based on those. Now, when I went over to the pediatrician's area, did you like your pediatrician? Or you don't know?
I like the one better in Thailand.
Which one?
In Thailand.
Yes. So the one in Thailand, it was a lady, and she was like, a lot, and I guess, the one in Thailand, we could understand them a little bit better, but it's okay. So we actually saw 2 pediatricians. So the first pediatrician, when I showed him the CDC, what the CDC was saying about the preventive malaria medications for, the preventative malaria medications, he wasn't really sure. He was like, no, I don't think we do that here. Let me go talk to the other doctor. And so Isabella, what happened with the other doctor? What was he using?
ChatGPT.
What did he say to ChatGPT?
I don't know.
She said the doctor was using ChatGPT. She saw him using ChatGPT. I just thought that it was so funny. But nonetheless,
I know the format, but I don't know what he said.
listen, nonetheless, we have our malaria preventative medications because we're going to be going over to Ghana for a group trip soon. And while I was here, I'm one of those people that's like, well, I'm here, might as well. So that's what I did. I was here at the hospital. I was like, I might as well get my 6-month labs done. So I normally every 6 months, check my cholesterol, check my iron, because I'm anemic and stuff like that. So I just got like a slew of testing done. And when I put all of the testing that I want on the list, when they added up, it was about 2 million. I was like, oh no, actually it was like 5.9 million. I was like, oh no, I don't think I want to do all of those. I don't think I want to do all those. And so I had to print off the list. And so I kind of circled exactly which ones that I wanted. And so even with the ones that I wanted, plus the doctor's fee, it was still only 2 million and some change, which is still pretty good. So my overall experience here at Vincom was that I'm coming back. If we need to go to a hospital, I totally feel comfortable, and I totally recommend Vincom. There's another hospital here that I want to visit just to see, how it is as a international guest. But I totally would recommend Vincom. Would you recommend Vincom?
Yeah.
All right. They have a small little cafeteria that's down here, but it's not like it's like they got, I don't know, but they have the what is it called? They got coffee and bagels and stuff like that. And so locals are here and international people are here at the hospital. But yeah, I recommend Vincom. And Oh yes. So once you're done with the doctor, before they give you a prescription or before they do your labs, you got to go to the cash register and pay. And so you go to the cash register and you got to press ticket, and it says if you're international or if you're Vietnamese. And I guess it's basically to match you with the right person that will understand you. And then you pay for your service. And once you pay for your service, you take the receipt back, and then they either give you a prescription or do your labs or take you and do whatever it is that you need to do. So yes, we had an interpreter. Yes, you're right. We did have an interpreter, and so within each one of the rooms, it was a doctor in each room. So similar to how it was in Bangkok. So I thought that was pretty cool. But overall, I enjoyed my experience here. If you guys have any questions about that, this is what it looks like once again. If you guys have any questions, let us know in the comments, and we'll talk to you soon. Bye.